How do hyperkalemia treatments impact kidney potassium channels? Imagine your body as a finely tuned machine where potassium levels need to stay just right. When potassium gets too high, especially in people with chronic kidney disease, doctors step in with treatments to bring those levels down. But how do these treatments affect the tiny channels in your kidneys that help manage potassium? Let's explore that. Your kidneys play a key role in keeping potassium balanced. They do this mainly in the part called the distal nephron, which includes the aldosterone-sensitive distal tubule and the collecting duct. Here, special channels called ROMC and BK channels help move potassium out of the kidney cells into the urine. These channels work alongside a pump called the sodium-potassium ATPase, which helps maintain the right balance of ions inside and outside the cells. In people with chronic kidney disease, many of these nephrons, or kidney filtering units, are damaged or lost. This makes it harder for the kidneys to excrete potassium. However, the remaining nephrons can adapt by increasing their ability to secrete potassium, including boosting the activity of these channels. This adaptation helps keep potassium levels in check despite kidney damage. Now, let's look at how treatments for hyperkalemia influence these kidney channels. First, potassium binders like patiromer and sodium zirconium cyclosilicate work in the gut. They trap potassium in the intestines, preventing it from entering the bloodstream. This lowers blood potassium levels without directly affecting the channels in the kidneys. By reducing serum potassium, these binders make it safer for patients to continue medications like renin-angiotensin-aldosterone system inhibitors, which are good for protecting the kidneys but can increase potassium retention by reducing aldosterone's effect on potassium channels. Next, diuretics such as furosemide, which are often used in heart and kidney conditions, act on the kidneys themselves. They inhibit a transporter called NKCC2 in the thick ascending limb of the loop of Henle. This causes more sodium to reach the distal parts of the nephron. The increased sodium flow stimulates the potassium channels, especially ROMC and BK, to secrete more potassium into the urine. So, loop diuretics indirectly boost potassium excretion by creating an environment that encourages these channels to work harder. Medications like renin-angiotensin-aldosterone system inhibitors and mineralocorticoid receptor antagonists, which are used to protect kidney function and treat high blood pressure, can actually decrease potassium secretion. They do this by lowering aldosterone levels or blocking its receptor, which normally increases the activity of potassium channels and the sodium-potassium pump. This can lead to higher potassium levels, making management tricky. That's why treatments that lower serum potassium are so important. They help keep these medications safe to use without risking dangerous hyperkalemia. In severe cases, dialysis can be used to remove excess potassium directly from the blood. This process bypasses the kidney channels altogether, providing a quick and effective way to control potassium levels when other treatments aren't enough. So, in summary, hyperkalemia treatments influence kidney potassium channels mostly by changing the conditions around them. Diuretics increase sodium flow and tubular fluid movement, which stimulates potassium channels to secrete more potassium. Potassium binders lower overall potassium levels, allowing the continued use of medications that might otherwise reduce potassium excretion. Understanding these interactions helps doctors balance treatment options carefully, especially in patients with chronic kidney disease, to protect kidney health and prevent dangerous potassium spikes. Always remember, managing potassium is complex and individual, so it's essential to work closely with healthcare professionals to find the best approach for each person.